call to order the LaPorte County Board of Health meeting today, October 22nd, 2019. Please stand for the Pledge of Allegiance. Pledge of Allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Dr. Newhouse?
Present.
Ellie Vaughn?
Here.
Dr. Dora?
Here.
Dr. Howe?
Here.
Michael Sandy?
Here.
Lauren Arnold?
Present.
Monique Thomas?
Present.
Michael Mullenhour?
Present.
Okay, thank you. We're all here today. Wonderful. Next item on the agenda is the approval of the board minutes from July 16th.
I so move we accept them as printed.
Is there any discussion or questions first before we approve it? Anything? Any corrections? No? All right, then I'll entertain a motion to accept the minutes from July 16th.
I so move.
I'll second that.
All in favor?
Aye.
Anyone opposed? Nope. The board minutes from July 16th, 2019 are accepted. Public comment. Is there anyone here for a public comment? Third time, is there anyone here for a public comment? Hearing none, we move on. Next item on our agenda is the health officer's report. Dr. Ducey is unable to be here today. Her information is in our packet. I propose that we accept her report. Are there any comments, questions, or discussion about Dr. Ducey's notes?
I have a comment.
Yes, ma'am.
She was talking about vaping, and I just wanted to say that the Drug Enforcement Agency is having a national RX take-back program on October 26th from 10 a.m. to 2 p.m. LaPorte County at the present time doesn't have a drop-off for this program, but New Carlisle, Chesterton, Porter County, St. Joe County, and Marshall County all have drop-offs at their police stations.
That's excellent information. Thank you.
You're welcome. And they are accepting vaping products.
All right. Thank you very much. Any other comments about the health officer's report? Hearing none, do I hear a motion to accept the report?
So move.
Is there a second?
Second.
All in favor?
Aye.
Any opposed? The health officer's report is accepted. Next item on our agenda is the administrator's report.
Good evening. First, I'll talk about personnel. Amanda was selected by the EPA to make during the month of September. September 18th was Smart Septic Week, so she made a presentation on a property transfer ordinance. Unfortunately, that property transfer is pretty big because it was nationwide, but basically, she was asked questions about how we did it and how we implemented and all that, so she did a fine job at it. They recall back in July, I had one of the nurses leave, Daniel Glasgow, but I was able to keep her as emergency preparedness. I took part of the emergency preparedness grant and paid her salary for her, so she's only part-time. So I do have a part-time emergency preparedness coordinator, so that's good to have. Every county should have one of those. So I was able to use the preparedness money grant. But we also did hire another full-time nurse, Julie Coase. So we're full staff again now. Okay, moving on. Back in August, I was approached and the commissioners that several people, county employees, became ill with respiratory illness from the Hyler building. That's where some of the county employees were across the street, the Hyler building. So what happened was we hired an engineer firm, Environmental Safety Technologies, came and tested the water there and tested the cooling tower on the top, and unfortunately the cooling tower on top of the building was positive for Legionella. So the maintenance department did everything they can to clean it, so they fixed that and we retested it so everything's back to normal. But the water inside the building was fine, it was the outside of the building. Amanda can talk about it more if she wants to do in her report. And lastly, I submitted the final two for grants every year. Like I always talk about the local health maintenance fund and our local trust fund grants that I apply every year for the state. Thank goodness every year we get it because I pay for one full-time employee, one part-time environmental and nurse and intern, and I also, this is how we pay our postage and ink and all that for office supplies for the department. So it's a pretty nice grant that we're able to receive every year. And that's it.
Good. Congratulations on that grant. Are there any questions or comments from Mr. Mancuso?
Yes, I do. On the Highland building, have we put that now on a maintenance? So
Right,
we're
yeah,
going to do that from now on?
Yeah, the maintenance building, we put them on a schedule, but right now the cooling tower is shut down, so we did sample it 3 times, I believe.
Yes.
Just 3 times. So,
And after our last meeting, I think the Monday after our meeting, you're going to go into budget, and you haven't mentioned anything. How'd that come out on what you put in? And
the budget was approved.
I mean,
Yeah.
employees get pay raises this year?
I don't know yet.
Well, that's still out?
That's still, I talked to the gentleman next to me.
That's all I have.
Yeah, the budget was definitely approved.
Okay, very good.
Yeah.
Any other comments from Mr. Mancuso? If not, do I hear a motion to accept?
So move.
Second.
Okay, all in favor?
Aye.
Anyone opposed? No. Motion is passed. Nursing Supervisor's report is next. Jennifer Smith, RN.
We had our VFC site audit, and both of our offices were audited for vaccine storage and handling and the administration policies, and we had 0 violations during this audit. We received a certificate of excellence recognizing our Michigan City branch office and increasing their human papillomavirus or HPV vaccination rates by at least 25%. We attended the Indiana Immunization Coalition Annual Flu and Adult Vaccine Summit, and we learned about the flu update, vaccine preventable illnesses affecting adults, and a timely update about the use of vaccines. We had our confidential services clinic state audit this last quarter also, and we had 0 violations found during that audit as well. We spent the final funds from our lead education grant on a billboard campaign. We're doing a lead billboard that will rotate locations throughout the county over a 12-month period. The first one is now, it's up now, and it's on 400 by Walmart, and that is for Lead Prevention Week. And then every month it's going to change locations, and a new message will go up about healthy homes and lead testing. We've begun our annual flu vaccine clinics for the year. We had 2 county employee walk-in clinics at the office, and we went on our off-site to the county highway and did a clinic for them. We had 2 cases of Elizabeth Kingia blood infections this last quarter. None of us had ever heard of this until it came about, but it's normally, it's commonly found in the environment, and it affects immunocompromised individuals. Both of these people that were affected were long-term care residents. Typically, it causes meningitis and blood infections and respiratory infections in people with weakened immune systems, and it was a bacteremia in both of these residents. We received notices that there's been eastern equine encephalitis activity in the northern part of Indiana. It's a reportable mosquito-borne virus that could be transmitted by 3 types of mosquitoes found locally. There has been an update. There has been 1 death in Elkhart County from this in an individual. And speaking of the vaping that was mentioned earlier, the State Department of Health has confirmed the first death in an adult from vaping. We had 1 in LaPorte County that did not die, but that was in the intensive care unit, and we're arranging at this time to send the vaping liquid to the State Department of Health for testing. So that just happened late last week. And all of the nurses were recertified for our CPR and AED this quarter. That's all I have.
Thank you very much. Are there any questions?
I have a question. The Elizabeth Kingia, where in Indiana did they find these residents that...
LaPorte County.
It was in LaPorte County?
It was.
From one of the nursing homes around here?
Yes. Same nursing home in LaPorte County.
Okay.
All right, any other questions? No, if not, do I hear a motion to accept the nursing supervisor report?
Aye.
All in favor? Second?
I'll second that.
All in favor?
Aye.
Anybody opposed? No. Environmental Health Food Supervisors Report, please. Amanda Leonards.
Good afternoon.
Good afternoon.
I apologize, I got crazy here and stuff. We've been outside all day at a team building exercise, and glad we did it. It was a lot of fun and learned a lot today. So, it was a crazy quarter. We did do the environmental assessment on the Hyler building. The commissioners were concerned that there were several people there who had been sick. And somebody had tested positive for Legionella bacteria or pneumonia, and they wanted to make sure that the building was safe and it wasn't one of the causes of illness. So I was able to contact a company in Kentucky. They came out of Louisville, Kentucky. I contacted them on the 5th of August, and they were here on the 6th. They drove up the very next morning to come up and do an assessment and collect samples. So we had to go with the company was on the short list because they were a CDC elite laboratory. So they're certified by the CDC to do the Legionella testing. So they came up, all of the water samples inside the building were fine. They did 13 samples altogether, and it was the 13th sample, the cooling tower on top of the building, which is for the air conditioning. It's a closed system, but it's open on the roof. So you can't get it inside the building, but you can catch it when you're outside the building. So it did come back positive for the bacteria. It was remediated. They had actually already started working on it. Actually, there's a maintenance program in place with that cooling tower and a company that comes in monthly to check on that. There's biocide that is added to the water to prevent bacteria from growing, or I should say prevent the scum layer on the outside where the water is passing through on the surfaces of the unit.
Are you talking about the inside surface?
On the inside surface of that unit, yes. And to keep the bacteria from growing. But they weren't testing for bacteria. So we've added that into that water management program that will be tested monthly for bacteria. And then continuing with the changing of the biocides and the chemicals that are being used, so it doesn't get... You have to change chemicals out periodically to make sure you have bacteria that builds up resistance. And, it just takes that one bacteria to become resistant, and it multiplies. So you got to change it up next time to make sure everything's being killed off.
So this was water that was going in the air conditioning?
It was water in the air conditioning, but it's not, the cooling towers, it's a closed loop system. So it's basically an air exchange. It's water sealed in the tubes, circulating through, cooling the air, but the water doesn't come in contact with the air inside the building.
How did people get sick?
So you get Legionella pneumonia from the bacteria that's in a water mist. So you actually have to inhale the mist. And that could be that cooling, it can be a cooling tower on the top of the building, and that mist spreads out. So anybody walking by within almost a half mile or a mile range could breathe that in. You can get it, a big one is hot tubs. That's a lot of times it's hot tubs or some other kind of water feature. If the water is warmer water, if it's in that 70 to 90 degrees water.
Does that cooling tower have a roof?
No, it's open.
So is that something...
On the side of the buildings, on the side of the units, they're open.
Okay, and you have to leave it open to cool. Mm-hmm. And that's why there was a possible mist. Mm-hmm. Is there any way to, because that's part of the infectious loop, is there any way to deal with that so that we're not getting misty, or is it just...
There's no way to really control the mist, it's controlling the bacteria, the growth.
Okay, I got it.
Yeah.
Is there a space up there that is typically used where people hang out, or like a smoker's corner or something that people are using up there that is
no, this is on the roof. There's no access to it. There's no public access to that roof. It's kind of a really sketchy ladder to get up there, actually.
Is the theory that people got sick walking on the sidewalk or in the building?
Not necessarily, not inside the building. There's no way to have got it
Right.
inside the building.
Yeah.
It's outside.
Okay.
If anybody got sick from that unit, there's no way to prove that unit was the actual
Right.
cause of infection
Okay.
without doing DNA testing of the
And how
pneumonia
many
the person
people-
had.
How many people became symptomatic with that?
Within the Hyler building, there's 3 people symptomatic.
3?
Yes.
And they're doing okay?
Yes.
All right.
It's curious that Chesterton closed 2 schools and an administrative about the same, well, several weeks ago.
Yeah. The beginning of this month, yes.
Is it weather related or season?
So we've spent a lot of time on the phone with Indiana State Department of Health and the CDC, and with this Legionella CDC team, they do nothing but Legionella outbreaks and investigations. So it's been interesting because I'm a nerd and I like that stuff. And they have talked about they have seen some changes with the warmer weather. When we got, we have how many cases now? We have 19 cases of Legionella in the county, which is almost double our normal amount.
For what period?
From July to last week. Our last case is last week.
Okay. Do you expect this to drop off now that the weather's colder?
If the sources were the cooling towers,
Yeah,
yes.
yeah.
If the source is something else, if it's a hot tub or a shower, it could be somebody's plumbing in their house. I mean, you don't know. Yeah, I know. You'll go crazy trying to.
Just educate us a little bit. What's the source of the bacteria? What is it? Birds or what?
Legionella bacteria is a group of bacteria that's just present in the environment at all times. So it just takes the correct conditions for it to grow and multiply and to become a high enough to cause infection, a high enough count to cause infection. So really bad. It has to have water. So the water temperature has to be just right. The wind conditions have to be just right. You have to have enough of a biofilm on the inside of the cooling tower or inside of the pipe for the bacteria to adhere and grow. So it's a lot of different things coming together.
The treatment is successful with antimicrobials, or is there resistance developing?
So,
or is that for Dr. Ducey?
Yeah, that's, yeah.
We'll show
Yeah,
that.
it can be. I mean, it's Legionella pneumonia is very serious, and I think it says almost a 30% fatality rate
It's very
with
serious.
it.
Yeah.
So, yeah.
Wow. Okay. And
Oh, I do have others. Sorry, I got distracted by Legionella. Is there any more questions on Legionella? The other big thing that happened, it was all kind of going on at the same time, was I was asked by the EPA to be part of their webcast series this year for Septic Smart Week. I was one of 3 people to present, and it was very interesting to. Always, usually when you're talking and presenting to people, and I was in my office with the doors closed and all the windows blocked out so nobody could be making faces at me, and basically talking to myself. It was, they could see all my slides, clicking through my slides, and just talking, but it generated a lot of good discussion. I got a lot of questions, and I've still been getting contacted from people all over the U.S. Asking for information. This is a very hot topic. A lot of people are talking about still the not only the history, because I talked about LaPorte County history of septics altogether, but then also ending with that property transfer inspection program. And there's a lot of places looking to go to that, and we're still, LaPorte County is being looked at as a success for that, and also using as a template for other people to implement their own programs. So that was great. And I think all my jokes were the same. I don't have any new jokes. They were all the same, but anyway.
Septic jokes?
Yeah, septic jokes, Poop jokes never get
Email it to the
boring,
board.
do they?
Yeah, email.
Yeah. We did attend the fall conference again for the Indiana Environmental Health Association, where I lost my tiara as Environmental Health Specialist of the Year. But the person who got it, Lee Green, is very deserving of it. I'm very happy to share that with him. The conference was held locally this year. It was over at the Century Center in South Bend, so everybody was able to go. There was over 200 people that attended that. It's a 2.5-day conference on septics and foods and preparedness, swimming pools, bugs. So it's always a good time. Very good learning opportunity, training opportunity that I'm glad that we're all able to take part in. Our invoice for item contract, remember we were awarded up to $8,300, but it all depends about the number of samples that we actually turn in. So we billed item for a total of $5,676 for our samples. And we added a new stop this year. We lost stop 37 along with stop 34 this year just because of beach erosion and unable to safely get to take those samples. Stop 14 was added in about halfway through the year, I believe July 6th was our first sample. And again, the numbers were actually pretty low with Lake Michigan. There was one advisory for the whole year on Lake Michigan. Inland lakes, there's a completely different story. Again, we're still seeing high numbers, especially in the Fish Lake area. Upper Fish Lake. Lower Fish Lake was only one, but Oldstone Lake was up a lot this year from the previous years. And I don't know if that's turning in kind of a hot spot for the geese to hang out. So I really think that's what the problem is there. But a lot of people don't actually swim there because it's pretty rocky and there's no place to park. But it still is a good sampling area. We've done over 280 temporary food inspections in the third quarter. Along with, that's not including the fair. The fair we had 48 temporary vendors at the fair and probably about 10 mobile permits. We did those and they were really good this year. So I don't know if the stars just aligned just right or we've been doing it long enough and working with the same vendors long enough that they know what we're going to be expecting and looking for. So we did not have the problems that we have had in previous years. We still are doing up to 10 random inspections every day. I think that helps a lot in putting that into place because knowing that we are there, we are present, and somebody's going to get, it could be you every day. It could be you every day. Just because you've been inspected doesn't mean we're not going to come back and check. And especially when it gets towards that end of the week. But they definitely need to make sure that we're still there and present. Everybody by the end of the week is tired and cranky and they just...
There's a lot of, it's hot, the fair, and there's a lot of animals and there's a lot of dust being stirred up, so I'm kind of glad you guys are there. I love the food, love the corn, but I'm glad you guys are there on hot summer days.
Yes, yeah.
Okay.
One of the big bonus things is that the fair is now off of well water. And it was all city water out there. So we weren't having to test the wells. We usually they have 5-6 wells out there. We would start the week before testing that to make sure the water was safe and potable. And then also during fair week, and we didn't have to do that this year. We didn't have to worry about that because if the bacteria comes back in the wells, that shuts down everybody and they have to bring in bottled water, which is not a lot of fun. And that's all I have.
Thank you. Are there any questions for
I have a question
Amanda?
about the new establishment, the new taco food coach. Is that the one that's in the Cave Ones on the east side?
Yes.
Okay. I was wondering, I passed
Yeah.
by and I didn't see a name on it.
Yeah.
Any other questions? If not, do I hear a motion to accept Amanda's report?
I move to accept Amanda's report.
A second? Anyone?
Second.
All in favor?
Aye.
Anyone opposed? Report is accepted. Thank you very much. Hi. Next report is from Ann Rissman, our health educators report.
Okay, so the Narcan program, I'm still working on trying to train the trainers for people to be able to train people in their own place of business, whether it be counseling center, case managers, that kind of thing, instead of trying to have open Narcan trainings for the public because nobody was coming. So this is a way to try to get it out there directly. So I'm continuing to do that. What I forgot in the report to put, besides the 3 back-to-school events that usually happen in LaPorte County, I was only able to make 2 of them this year. But those are the biggest events to reach the most amount of people in the shortest amount of time. So those are always good events to do. But I forgot to mention that National Child Passenger Safety Week is from September 15th to 21st. And normally LaPorte County does an event for that week. We get money from the Automotive Safety Program to put on that event. And this year we did 2 events. They unfortunately happened to be on the same day, but at least it was 9 to 11 and I think 11 to 2. So at least it was a different time. But the first event was in LaPorte. I coordinated with the LaPorte Fire Permanent Fitting Station and got the money for the seats for that event. We had it there. It was not well attended. Then I provided booster seats from the State Department of Health to the Franciscan event at their hospital, and that one was unbelievably crazy. They did not have enough techs for that event, and it was too long of waiting for people that came to that event, but we did the best we could. But I forgot to mention those in my report. This time of year has been a great time of year for grants. A lot of grants have been getting thrown around. I didn't tell Tony yet, but we were denied the Unity grant for car seats for this time around, so that happened in this quarter. But the TROS grant, which I put some information about in your packets, the State Department of Health was awarded a CDC grants Data to Action grant. It was $23 million for the state of Indiana. So there is 10 to 13 focus areas that the State Department of Health is planning to do over the next 3 years. And there, locally, we formed the TROS group, which is the Trauma-Informed Recovery-Oriented System of Care, which I am a part of. And that is all of the agencies coordinating together to have the same, everybody offering the same information wherever they go. So if they go to the hospital, they're going to get the same information for safe and overdose happens at the hospital. They're going to get all of the same information that you would get there, whether they go to Swanson Center or whether they go to LaPorte Hospital. That's kind of what this group is trying to form and create wraparound services so that everybody knows what everybody else is doing. We're not duplicating services. So that's the idea behind the TROS group. Along with that, the TROS group came out of the Quick Response Team from the FSSA grant that we received last year, and the City of LaPorte was a pilot program. So this TROS group is kind of an expansion of what they had last year. Now it's called, instead of the Quick Response Team, they're opening it up to all of LaPorte County, and it's called the Mobile Integrated Response Team. So they're calling it the MRT. They dropped the I for some reason. So I'm part of that this year as well, just in the fact that I'm providing that same group, which I did for the QRT, providing them Narcan and training the trainers how to train families when they go out to respond to overdoses in the community where they're requesting them to come back and give them information about services and treatment and all that stuff. So they have the Narcan with them and they can train the families at that time. So I'm training the trainers to train the families. So we're doing that with the mobile response team also. And along with that comes the ECHO grant, which is the Indiana, I forgot what it was called. That is another grant that it's for all those 13 focus areas that coming from the State Department of Health. This ECHO grant is from one of the focus areas, and it is a grant where they're going to be doing the community agencies are all coming together to provide training for people to use in the TROSC, whatever their result is from the TROSC group. So there was 4 strategic areas that we could apply for, and one of them, which is also happening this quarter, not last quarter, to expand the Narcan program to get another person to help me out, since that's only a small part of my job. So it really could be, I could use some help to do the program the way that they want me to do the program. That is, I think that's it for me.
Thank you. Does anybody have any questions? Anybody? If not, then Health Educators Report. Do we have a motion to accept it?
So move.
Anyone second?
No.
All in favor? Anyone opposed? The motion passes. Attorney's report, please.
Thank you. I do have, unfortunately, a couple of things to report. We filed a complaint against a property owner for a public nuisance health violation, and that was filed this week in Superior Court 3. And we have all the documentation to back up our complaint. The health department has done a great job of documenting all of the voluntary compliance letters that we've sent out and abatement orders, and nothing's being done. So our last resort is to take it to court. And like I said, we filed that, and we have a court date. I believe it's in November, second week of November. I can't remember the exact date, but we have filed that, and we're moving forward with that. And the second problem is another food ordinance violation complaint, and we're contemplating on filing our complaint in court as well, and that likely will be filed by the end of the week. And so aside from those 2 issues, we don't have any other legal issues to report.
Any questions?
What would be the nature of the nuisance of the first?
It is a violation of not removing garbage and rubbish on the property. It's just a lot of trash and garbage that wasn't disposed of properly.
Okay.
Which is a violation of Indiana Code 164120-6.
Any other questions? And if not, do I hear a motion to accept the attorney's report?
So moved.
Any?
Second.
All in favor?
Aye.
Anyone opposed? Attorney's report is accepted. County Council Liaisons Report, please.
Mike?
I really don't have anything to report. I know it was mentioned before about the raises, or this year's potential raises. We've okayed our 2020 budget, but not for the employees yet for any possible raises. That's still under discussion. So other than that, I think everything's going pretty well. If you have any questions, free.
Anyone have any questions? If not, do I hear a motion to accept the County Council Liaisons Report? A motion, and then we would need a second.
So moved.
Okay. All in favor?
Aye.
Anyone opposed? Ayes have it. We accept the report. Old business. We don't have any old business. Any new business? Does anyone have any new business?
I have a question. I
Sure.
heard that with the crazy waves that we were having in Lake Michigan and things, that we had someone from the state health department come to look at our beach situation. Is that a true rumor?
Not that we know of. They would contact us if they did come into the county.
One of your health inspectors told me. She was visiting me.
Really?
Yeah.
Well, I know the waves have been tough, and I think there was an email from.
Was it a site? Could have been a donut.
Hi. So the only state person I could think of would have been David Ortel, out of the septic group, our septic coordinating person, and he hadn't been up here specifically for that, but that's something that we're always looking at.
Did we have any more failures or anything?
No. Well, we've had uncovered during property transfer inspections, or we've had to put more people on pump and haul, but we haven't had anything else washing away or any other specific investigations on a specific site that he's had to come up for.
So if the state did come up, it would be because you guys requested it, you'd know it.
Right,
anyway.
they can't just show up.
Right, that's...
I mean, they can, but...
There's a chain of command.
Right. They have to be invited in.
And listen, have we affected any sales? Sales between...
They're selling like crazy, yeah. They're buying $2 million homes on pump and haul permits, so, yeah.
Really?
Really.
I mean, I see homes going up. I didn't know if it was pump and haul. I guess it's kind of like a holding pattern waiting about the septic system. That's where that's at. Mm-hmm. Okay. Any other comments? If we have no new business, let's talk about the next meeting in January. 21st is a Tuesday. Is there any?
The offices are closed.
21st is a Tuesday, yes.
Is there any conflict?
The county offices are closed on the
Say
20th.
again?
The county offices are closed on the 20th.
It's 21st. Is what I was asking.
Okay.
So are you saying? I don't know what you're saying.
Too soon after the holiday? Is that what you're saying?
You're saying a 4-day weekend. Got it.
We should make it January 28th.
We could make it that or the 14th. Does that interfere with the long weekend?
Weather permitting.
Weather permitting.
Oh,
Remember last year we canceled.
Yeah, I do remember last year. All right, let's do it the 14th. Let's do tentatively. How are we good? Are we good with that? Numbers? Okay.
Same time, same place?
Yeah, let's go somewhere different. Maybe a pizza
Oh, someplace that serves beer.
place.
So you said
Place.
14th?
14th.
14th.
Julie, is that? Got it? All right. So we've got a date, and other than the date, we're at the last part, which is adjourn. Unless anybody has an objection, I will adjourn the meeting. Thank you, everyone.